Welcome back to Learn Neuroradiology, everyone. This is going to be the second example case from the CTA head and neck course, which goes with the vascular capstone. So if you're ready for the second case, go ahead. Again, if you haven't seen it already, go back and check out the overview of the course where you can learn some of the general tips for looking at CT angiograms of the head and neck and also look at a general search pattern. If you're ready to move on to the second case, let's go ahead and get started. This second case is going to be a 47-year-old woman with new neurologic symptoms. You can find this case at the link right here, so if you want to browse it yourself, go ahead. You can do that in your own window. You can pause the video and come back when you want to go through it with us. So let's start by looking at an MRI. The first set of images here is going to be an MRI, so we'll take a look at that now. So if you're on the page for the vascular capstone course, you just want to scroll down and go to case B. Which is going to pull it up in a side window here. And so this again is a ClearPax window. And in the top left, we're going to have some images from an MRI. And these are diffusion weighted images from an MRI. So they're pulled up here. So we're just going to scroll through these and see what we see. This patient is a middle-aged woman. She has new neurologic symptoms. Diffusion's looking pretty good so far. But then over here, kind of the left posterior temporal lobe, we see something that's a little bit bright there. Here in the insula and sort of peri-insular frontal lobe, we see some hyperintensity there, and we see a little something in the caudate. I see a few other scattered little areas, a few other little scattered areas in the left MTA distribution up here as well. So these are strokes, and this explains the patient's neurologic symptoms. So now we get to the first of the questions that you have about the vascular imaging, and that question is, where is the vascular abnormality on the CTA? So now we're going to take a look forward and look at the CTA images. So to look at the CTA, we're just going to go back to our main window. We're going to take a look at this top right window here, which is the CTA. We're going to double click it to get a little larger here. We're going to change to this fast scroll tool here so we can go through it kind of quickly. And so here we have a CTA, and we're starting out in the chest. And here you see the aorta. And what we're going to do is we're going to follow our search pattern that we already learned a little bit about. We see the great vessels coming off here. You have the brachiocephalic artery, the common carotid artery here. And you're going to have a subclavian artery coming off here. So that's your normal 3-vessel arch that you have. And what we're going to do is the brachiocephalic bifurcates here. And we're going to follow up this right internal carotid artery as it goes up. We're just going to follow that. That's the common carotid rather. So it comes up, and we don't know exactly what that is. Like maybe it's a little filling defect there. We'll come back to that. And there's the carotid bifurcation, so it looks okay so far. And as we get into the distal carotid artery in the neck, it's looking okay. The caliber changes a little bit here. It gets very tortuous, and like you have a little bit of narrowing there. It gets a little wider again, kind of very irregular looking. So that is definitely not normal, but it doesn't exactly explain the abnormality that we were seeing on the MRI, because it's on the wrong side. So we're going to come back down now, and we're going to look, we're going to continue following our search pattern with this common carotid here. So now we're looking at the common carotid. We're going to follow this up. It looks okay so far. We're going to get up to the carotid bifurcation here. We start seeing there's something funny going on here. We see some luminal narrowing, and it's kind of smooth tapering of the vessel with this low density material along the lateral posterior margin of the vessel. The vessel is very narrow, and then that low density thing has very irregular margins there. And as you come up, it's going to be continue to be irregular. And say on this image right here, we see what looks like this low density filling defect in the middle of the vessel. It's a free floating thrombus is what you're dealing with there. So we have a smooth tapering of the ICA. And then if we follow it up a little bit further, what we have is, again, we're going to see some irregularity of this ICA. It's very tortuous for age. You see maybe another little filling defect there in the ICA. It gets bigger again, and it's going to come up and become intracranial. So we've got some bilateral ICA abnormalities. It's very strange for the patient's age because she's pretty young. Now we want to come back, and we'll just take a look at these vertebral arteries just to see how they look. We're going to start with this right vertebral artery and just follow it up as it enters the transverse foramen there, comes up. Looks not bad, a little tortuous, but we don't see any real areas of narrowing. A little bit tortuous is going to come up and enter the dura there. And then we'll just follow this other one here from the bottom. So we're going to follow the vert as it comes off the left subclavian there. Again, enters the transverse foramen. We're just following it up. And it looks okay. So the abnormalities that we're seeing in the neck are bilateral carotid abnormalities, and they're worse on the left. So on the left, we see like pretty bad narrowing, and we see what looks like a intraluminal thrombus there. And so that's what we're dealing with on this case. Now we can come up and we can check out the intracranial vessels if we're fully following our search pattern. We can follow the ICA here as it becomes the MCA. See nothing too serious going on with those MCA branches. And if we follow this ICA up, it looks okay. Again, the MCA looks all right. We don't have any big proximal occlusion, but based on the size of those abnormalities on the MRI, we don't really expect it to be a big occlusion. We expect something small. Similarly, if you just take a look at the posterior circulation here, the verts and the basilar artery, as they come up and branch into the PCAs, it all kind of looks okay. So we're not seeing anything intracranially to go along with that. So let's just go back to our main PACS window. Let's take a look at the carotid arteries in sort of cross section here. So these are some projectional images or reformats of this is one carotid here. This is what we see here is a bifurcation. Maybe there's a little thrombus in there, like right at the proximal to the bifurcation. So this is the right carotid. And here we see the internal carotid. It looks okay. But it tapers a lot. It becomes very tortuous, has some areas of narrowing before it comes up intracranially. So let's take a look now at the left and see how that compares. And let's see what that abnormality looks like on the cross-sectional image or on the sagittal image here. What you see is the carotid bifurcation here. And then you have smooth tapering of the vessel. It becomes very narrow. And that's that free-floating thrombus that you see. And then the rest of the vessel distally is not normal either. It's very tortuous, has a lot of areas of irregularity and narrowing, maybe a little bit more thrombus in it as it comes up and enters the skull base here. So you've got bilateral abnormal carotids on this CTA, predominantly with abnormality within the neck. So now let's take a look at the questions that you have for this case. Your first question is, where's the vascular abnormality on the CTA? So we've already taken a look at these images and you just overview that. The left internal carotid artery has some severe narrowing. There's kind of starting at the bifurcation. It smoothly tapers, almost like a blade of grass or like a flame shape, and with some thrombus in the vessel distally. And the right internal carotid artery is not normal either. It's tortuous and irregular, and that's not what we expect it to look like. So what is the pathology that's behind this, or what is causing this? This is a carotid dissection, and that's the classic appearance for a dissection, that tapering appearance with some thrombus, and some thrombus extending beyond the dissection. And this particular patient also has fibromuscular dysplasia. And fibromuscular dysplasia is a vasculitis or vasculopathy that we'll talk about a little bit more in just a second. And the risks and complications of this, if it's not treated, is this patient can go on to have additional dissections. They can have chronic occlusion. They can have additional infarcts. So they're going to be at additional risk of developing new neurologic symptoms. So you can go back on your own and take a look at those images to see those findings again. So in summary, this patient has fibromuscular dysplasia, which is the most common vasculopathy in middle-aged women. The classic finding is this pearls on a string appearance, or kind of beads on a string, with areas where the vessels narrow and then dilate. And we kind of saw that in this case in the areas where the vessels kind of got narrow and were very tortuous and then got wider again. The most common locations in the body are the renal arteries. So you'll see them on a CTA of the abdomen or a renal angiogram. But then other areas that are commonly affected are the carotid arteries, such as this case, but also the vertebral arteries. These are associated with stroke and dissection, so these patients are at risk for these things and have to be treated frequently with anticoagulation to treat that. If they're untreated, they will go on to have additional problems. So thank you for tuning into this one. If you haven't seen the other cases, go back and check them out. Be sure to check out the rest of the vascular capstone course. And stay tuned because we'll have additional cases coming up in the next few days so that you can take a look at those that will go with the rest of this CTA course. So be sure to check out the rest of the videos on the channel, check out the website, learnneuroRadiology.com, and be sure to subscribe. So thank you guys.